Uh, Here at Nicklaus Children, every time that there is the potential of a local outbreak, we get prepared. We were prepared for Ebola, and we're now prepared to deal with this illness. We can get the diagnosis. We have a laboratory that will do the testing for us within 24 hours. We are prepared to diagnose these children and counsel the family and deal with this illness. The Zika virus was a virus that was discovered in 1947 in Africa and caused very small outbreaks. Was not a major problem back then, and then it reappeared in Polynesia. And now in 2015, they discovered that it was causing a huge outbreak in Brazil. And from there, it's really spread to most Latin American countries and also the Caribbean. It is primarily through mosquito bite, but also can be transmitted sexually. And also there is a risk of blood transfusions that could actually cause infection. The symptoms are really very similar to dengue and chikungunya. They're very hard to distinguish apart, and you have to remember that only about 20% of the people will have symptoms when they have this type of infection. They will have fever, usually low-grade fever. They will have body aches, sometimes headaches. They could have joint pain. They will have a very typical rash and also conjunctivitis. There is a number of tests. There is 2 tests that are very accurate. In the first week, you can do a test that actually detects the nucleic acid of the virus in blood, and the same thing can be done in the urine. And if it's somebody that had it a couple of months before, then you have to do serological tests that are done through the Center for Disease Control. So there is really a lot that can be done to protect yourself. Number one would be avoiding mosquitoes. You have to remember that the mosquitoes that are involved will feed during daytime, and obviously wearing long sleeves, long pants, using mosquito repellents. There's a number of them that are certified as safe, even in pregnancy. Staying indoors, air conditioning, keeping the windows closed, all of those things will help you avoid. The most important advice is that women that wish to have children immediately really should not be visiting endemic areas right now. They need to wait a couple of months before having children. And then for men, it's a lot longer. If they get infected, they're not supposed to have children for 6 months. And the reason for that is that the studies from Brazil show that up to 29% of the babies can be affected with microcephaly if you get an infection during pregnancy. So avoiding this infection during pregnancy is extremely important.